Okay, hello everyone, welcome. We'll give everyone a sec to settle in and get ready. Here we go. Happy Wednesday, everyone. I hope everyone's week is going well. Okay, and if we could in the chat, while we're waiting for people to trickle in, if you can put your name, the organization you're with, and kind of your role, and your pronouns into the chat, please. Here, I can do that as well. Okay. Well, we should probably get started. I think this might be critical mass here. We have about 27 people. So hello, welcome. My name is Nick Large. I am from an organization called Homebase. I'm a policy analyst. I think some of you might be familiar with us before. Maybe you haven't met me before, but you've met some of my colleagues. But Homebase, I like to describe us as an organization that supports communities in their response to homelessness. So that means a lot of different things, right? It means we, help people with trainings like this. We help people, apply for federal funding. We help them navigate complicated government regulations, comply with them, and all of that good stuff. And I am joined today by two of my colleagues. So I'm going to let, Joy, you want to introduce yourself?
Sure. Hi, everyone. Good to see you all today. My name is Joy. I'm a policy analyst also at Homebase, and I'll pass it over to my colleague, Maddie.
Hi, everyone. My name is Maddie Nation. I am a senior policy analyst with Homebase, and I'm here today just to provide a little bit of technology help.
Great. And so that will bring us to this next slide here in a sec. But first, hopefully you're all in the right place today. What we're going to be doing is we're going to be talking about the equal access rule and how you can more effectively and better support your LGBTQIA+ clients. And kind of starting off, I know we had some kind of questions in the beginning when some people filled out the registration form. They were wondering what the kind of acronym means and maybe why there are so many, right? And so we kind of spelled it out here at the bottom. You'll see a lot of different versions of this acronym, right? You'll see LGBT, LGBTQ, you'll see the plus. And so here, generally, you'll see the L first. So L stands for lesbian. Sometimes in older versions of the acronym, maybe like pre-80s, you'll see the G first. So you'll be GLBT. Interesting history there if you want to know. The plus will always kind of designate additional, right? So that maybe there are identities or kind of different nuances that aren't included in, whatever the lettering is, right? But here we go. Let's get started. And so first off, we have our little Zoom instructions here. So closed captioning is available. It tends to be pretty good from what I've seen. But if you have questions or anything like that, feel free to pop them in the chat or come off of mute. We have Joy and myself here. So if you're experiencing any tech issues, feel free to please message us. And again, feel free to post anything in the chat as well. And so what are we going to do today? Well, so today what we're going to do is we're going to cover a few things, right? But first, what I'm going to do is I'm going to start off with a little bit of history, right? I'm a big history person. I think history is very important. And having this kind of historic framework and understanding from where we come from in history can help you provide better trauma-informed care. Then after that, we're going to be talking about language and developing a shared kind of set of language, talking about some key terms and ideas that relate to topics of gender and sexuality. So you're going to be getting a lot of like a course, you know, a whole course of this in 2 hours. So it'll be lovely. And so please ask questions. And then from there, we'll be directly covering the equal access rule, also family separation, and how all of that applies to probably some of the different funding sources that your programs may receive, right? And then from there, we'll be looking at kind of best practices. We'll have some activities, some discussions, some scenarios, and so that we can better understand how equal access might apply to some of the different, you know, roles that you're all in, right? Does that sound good? Anyone have any questions on anything so far? Good. Okay. And so with that, introductions and agreements here. So if you haven't already, please put your name and pronoun in the chat here, your role in organization. And also if there's something you especially want to learn more about or you want to get out of this training, please put that in the chat as well. Yes, and I think we also have a representative here from the county. And so I believe I'm going to pass it to them. Lottie?
Yes.
Am I
It's
saying
Lodi.
Right? Lodi, I'm sorry.
Lodi, yeah, thanks, Nick. Hi, everyone. I'm Lodi Burdick with the San Mateo County Human Services Agency, Center on Homelessness. And just to kind of echo Nick's earlier statements, so we partner with Homebase, we contract with them to provide awesome trainings like this one today, as well as some other technical assistance support throughout this upcoming fiscal year. So I believe this is our first training of the year, which is really exciting. And so we're looking forward to this training topic today. Hopefully it's very helpful. Definitely a super important topic as it you know, relates to your everyday work and serving the clients that you all serve as best you can. So yeah, super excited. Hello. And yeah, with that, I'll pass it back over to Nick.
Great, thank you so much. Let's see, and here we go. So let's get started here. And so first, what we'll be kind of talking about is a little bit of the history and a little bit of that context, right, that I mentioned. This is like a fun little bit I like to bring in because you don't really learn about this history a lot anywhere, right? It's the kind of history that's not in our textbooks. And in fact is being banned in a lot of places right now. So it's always kind of interesting to learn about this history. You know, and we'll start off with a little quote from Bell Hooks here, right? And so our struggle is a struggle of memory against forgetting. Well, what does that mean, right? And so something that often surprises people and you know, is surprising when you first learn about this history, right, is that, you know, although right now in kind of Western society, we tend to think of gender as being kind of like a strict biological binary, right? You see male, female, go to the store, you see men's section, you see women's section. That hasn't been the case throughout history, right? And throughout history, right, even if you look at, you know, civilizations from the Egyptians, you can look at early medical texts coming out of Southeast Asia, all these different places, gender and sexuality have been thought of differently throughout time. And so right now we think of gender as being, again, man and woman, male and female, and we have this binary. But throughout history, that hasn't always been the case, right? And it's not the case in other places, right? So there are many other cultures around the world now and throughout history that recognize multiple genders, right? And so one example is if you look at kind of Native Hawaiian culture, right? There's a word mahu, which kind of is in between genders. It's a kind of translation for that. Lots of other indigenous cultures as well have different terms or different identities. outside of kind of like a man and women, male, female spectrum, right? And when we look at history too, we can understand and we can see that this modern persecution of LGBTQ plus identities is relatively recent, right? And so when we think about modern persecution, what does that mean, right? What does this kind of number 4 mean? Systemic persecution. It's a big word, right? But it means that we have lots of different institutions. So you can think about like criminal justice, you can think about medical, you can think about legal, all of these kind of different institutions we have. You know, in recent years, right, in American history, they've been designed to systemically persecute people who have LGBTQ plus identities, right? You couldn't look a certain way in public. Like right now, right, you see I have this like little dangly earring thing on. If I were where I live maybe 60 years ago, I could literally just be arrested because I'm wearing a piece of expression that wouldn't correlate with the identity that's on my, you know, my government ID. It was like that in a lot of places, right? And so this kind of systemic persecution that we have with all of these institutions, with like criminal justice, with healthcare, all of that is relatively recent. And so kind of other interesting tidbits, right? When you look throughout history, you can see lots of examples of these different LGBTQ plus identities. You can go to like feudal Europe, you can go to Egypt, you can go to China. And in fact, one of the earliest kind of medical texts, the text on surgery, it references several different types of sexual preferences and gender expressions. You know, so again, the theme is we have always existed, right? And so let's talk a little bit about some of this origin stuff, right, too. We have some time, so let's chit chat about it. And so when we think about the modern kind of like Western persecution of some of these different identities, we can trace a lot of that back to the early 19th century and some of the kind of pseudoscience that was going on around the time, right? And so when Western scientists first started classifying or trying to figure out, well, what is this race thing? How do we want to classify these different people? There was a theory that different races were distinct species and kind of descended from different kinds of animals, and that some people of different races were more evolved or less evolved than others, right? And there were these various pseudoscientific methods that proved that, you know, one race of people was more advanced, like maybe the size of their skull was different, the shape of some part of their face was different, and that was used to say, okay, well, this, you know, race of people is inferior. Therefore, you know, really when we have slavery, when we have colonialism, that's something that's not only valid, but it's something that we need to do, right? But as time went on, as we kind of learned more about basically science and about kind of this idea that was becoming more and more popular called evolution, the idea kind of transferred from being, well, people of different races are different species to, well, people who are, you know, non-white are underdeveloped and savage, right? And so you had all of these different kind of associations that also tied in gender, right, with race. So something like, you know, in some cultures, right, maybe if I'm wearing like this skirt or I'm wearing this certain outfit, it has a masculine kind of context, right? So when we think of like a kilt, for example, a kilt is kind of like a skirt, right? But has a very masculine context. But when you ask a man here in America, well, are you going to wear a dress? They're going to say, no, that's something for women, right? And so this context of what is masculine and what is feminine, it changes, right? It has a lot of different meanings. And what was happening with some kind of earlier colonialism, right, is they were applying these kind of Western notions of gender onto people they were colonizing, right? And so actually this photo here is from pre-colonial Hawaii. It's people who are called mahu, which is kind of someone in the middle. So it's kind of it's like a separate identity outside of man and woman, right? And so kind of continuing through this history and through kind of where these origins of persecution come from. So scientists argued that more advanced societies had women and men who were differentiated through appearance and gender roles. So basically that the way they expressed their gender looked very different, right? And so men had a certain type of dress and certain type of clothing, like you have to wear pants, and women had to wear these gowns, or they had to wear dresses, or were forbidden from wearing pants, right? And then through this kind of expression of gender and who was allowed to wear what, homosexuality and gender nonconformity became associated with savagery and primitive development, right? And so some of the kind of colonists who would go in would say, well, the men and women here, or the people here, they need to dress differently because they're all wearing these outfits that look very similar. Their gender expression is too similar. And so they're primitive, and so they're savage, right? Or they would look on these certain kind of behaviors, because sexuality and gender were very connected. They were seen as being kind of the same thing, right? So your gender role kind of dictated, or supposedly should dictate, your sexuality, right? And so that is a little bit of the history here. And so why is this history important? Well, history is important because the way different institutions and the different kind of systems that we work with, the way that they have pathologized LGBTQ plus people in the past has ramifications for how we do things today, right? So especially when we're taking into account a context of imperialism, everything from how we're collecting data, right? Think about when all of you were doing your assessments, when all of you are doing data input, right? Those very categories that you're putting, the very options that you have, are dictated by this history, right? What we consider a mental illness, right, is also dictated by this history. Who is protected in public accommodations, right, is dictated by this history. So we're here at this training today talking about this. But history, again, right, very important. And so I covered a lot of information there. I threw a lot of things at you. Does anyone have any questions? Anyone want to know more about anything? Was that interesting? Yes, we have some nods. Okay. Okay, here we go. Let's move on here. And so now the next thing we're going to talk about is we're going to set kind of a foundation for language, and kind of some key terms that are more related to equal access. And then also I'm going to invite all of you, because I don't know everything, right? There's so many different identity terms and things that I probably don't know. I know some of them. And so if you have any in the chat, let's share those as well. But first, starting off, some of the key ones I think we will probably need. So the three here: sex assigned at birth, gender identity, and gender expression. I have a little diagram in the next slides, which will hopefully make this a bit clearer if this is confusing. But a lot of times sex assigned at birth is what people think of as what's on your birth certificate, right? So like literally the what you were assigned when you were born. A lot of times this will be based on someone's external anatomy. Sometimes it will be based on other things. We'll talk a little bit about that later. But it also may or may not align with how someone kind of views their own gender, right? So that's their gender identity. And gender identity, typically, I think of that, and I see a lot of people think of that, right, as this kind of innermost concept of how you identify yourself, right? Like I think of, oh, I feel very strongly that I am a man, or I feel very strongly that I am a woman, right? One's gender identity, right, again, can be the same or can be different than the sex that's assigned at birth. And gender expression is basically how you express your gender, right? So this is kind of anything that can be visual. It can be the kind of clothing you're wearing, right? Earlier, the example was this like dangly earring thing that I have here. It's a type of gender expression. It could be things like also clothing, right? We talk about clothing. It could be other things like behavior. It could be body language, haircut, it could be voice. It could be this whole combination of things, you know, some more intentional, others kind of probably just come out as you're walking or just moving around, right? So gender expression is basically all of these different kinds of things that you can observe or see or feel with all of your senses, right? And another important point about gender expression, right, is again bringing it back to, you know, things that sometimes some cultures or some places think of as masculine might not be the same in other places. And throughout history, it changes too. So a really interesting example of that actually is high heels, right? So right now we think of heels, I think mostly around the world as being kind of a very feminine expression of gender, right? But it actually used to be a very masculine expression of gender. So heels were originally worn if you were like riding on a horse, right? Like if you're like riding in the strip, because the heel kind of like goes over that. And so the people who would wear heels were like warriors or like people going into battle. So it was a very masculine thing. So fun, interesting fact about gender expression. Any questions about any of that? Does that make sense? Is it interesting? Some nods? Okay. And some other definitions here. So gender nonconforming, sexual orientation, and intersex. So gender nonconforming is kind of an interesting word because it can be both like a descriptor, right? You can describe, oh, this person is, you know, their outfit is gender nonconforming. Or it can be, I see a lot of people identify as it also. So it can be like an identity, but also a descriptor. And so kind of at its base, right, the term gender nonconforming means you're not conforming with kind of what the traditional expectations of, you know, whatever gender is, or you're maybe your appearance is more androgynous or something is more androgynous and like people aren't able, they don't know exactly where to place you. Like if they don't know if you're male or female or what, right? And so it's just not conforming to what this traditional expectation of gender is, I think is kind of the core idea. Sexual orientation, right, is kind of what are you attracted to, right? And so, you know, in the kind of alphabet soup kind of acronym, right, that's kind of the gay, lesbian, bisexual part. Queer can be an interesting word because it can be in terms of sexuality, it can be in terms of gender. I think it's also a very like political word. You have some people who will very strongly identify as that word and other people who don't want to hear that word and they have very strong associations with it. And so it's an interesting word, right? Intersex. And so intersex is kind of an umbrella term that's used to describe a whole different assortment of kind of naturally bodily variations, right? More based in kind of like anatomy, more based in kind of hormones, more based in kind of chromosomes. So based in this kind of biological aspect. And we'll talk a little bit about what that means in a sec. But that brings us to this gender unicorn. So has anyone seen this before? I feel like everyone uses this. No, this is new. This is new. It's exciting when it's new. Okay. But the kind of core idea of this, right, is often we think of a lot of these different types of identity categories as being fixed. Again, it goes back to that whole binary kind of topic, right? So we think of men and women, we think of like you're gay or you're not gay. We think of in terms of biology, right? Sex assigned at birth, we think of female and male. but humans are actually incredibly diverse, surprise. And so there's a lot of variations among this category, all of these different categories. And so, when we're trying to place people into specific categories, that's why it doesn't always work, because we are a lot of different things. And so here, right, this is trying to get you to think of some of these different kind of categories as not just being set, but like a continuum, right? And so you have gender identity, right? You see the little cloud and there's a rainbow in the cloud. So it's kind of, again, that innermost concept. You have these little green dots here, right? Gender expression. And so that's kind of the, what can you observe or with your senses gather? You have sex assigned at birth here. And so even like a category people think of as being based purely in biology, and okay, well, because of that, then there have to be these specific categories. It's not always true either. People aren't always necessarily easily classified as what would be male or what would be female, right? There are a lot of people who don't fit some of those traditional kind of characteristics. So for example, my mom, she used to work at like a special education school. So not like kind of like ADD special ed, but like a very specific type of special ed. And it was actually very common at the school she worked at for kids to have, chromosome pairings that weren't like XXY or XY. So they would have all different variations of different chromosome pairings. A lot of people were intersex actually at the school that she worked at. So if you're a medical professional, you've probably seen it before. It's not something that's like extremely common, but if you've been a nurse for a while, it's something that pops up every now and then. Any questions on any of this?
I just want to make a comment. This is Ina.
Yeah.
Hi, before we only have female and male and homosexual. That's it, right? So now it looks like there is an extended representation for everyone, which is exciting, and it's more of the whole capture of the whole gender issues or something. That's just my comment. Can you hear me?
Yeah, let's hope so. Let's hope that's what that's what we're doing. Yeah,
it's female, male, and then homosexuality. I'm homosexual or something. But now there's a lot of gender identity that's you presented out there, so which is really good. I mean, yeah.
It's always super interesting.
Does it make sense?
No, yeah, I think it makes sense.
Okay.
And it's super interesting to me how all these words and the terms we use change too.
Right.
Like I'm what am I, 32? I'm 32. And when I first started my undergrad, when I first started college, I went to community college, and there was it was called the Rainbow Alliance, right? It was like the Rainbow Club or whatever. And there was this huge debate on if they should call themselves like the Queer Alliance, right? It was like a massive debate. There were a lot of feelings on both sides. And, now fast forward however many years in the future, and people identify so strongly as queer, and that kind of like strong conflict doesn't really exist as much anymore.
Right.
And I see all kinds of new words that like I've never seen before. Like someone sent this like website to me, and it was like all these different identity terms, and it had maybe like 60 or 70 different words on there. And I'm like, I haven't heard of half of these. And like, I'm very ingrained in this community. Yeah, so it changes, right? It changes over time. So any other questions or comments or anything? Yeah, are there any kind of identities that all of you can kind of think of? I don't know, that we haven't talked about that you want to put in the chat or anything like that?
There's gender fluid.
Gender fluid, yeah.
People who have like one time, even during the same day, like in the morning, they feel like a man, in the evening, they feel like a woman. Or non-binary, or they just, with their emotions, and I don't know, as time progresses, they feel like different things in different situations and don't like to be pigeonholed into one thing.
Yeah. Very good word. I actually identify myself as gender fluid. So that's usually, that's the term that I usually kind of tell people. So I kind of think of it in a similar way. I'll usually use that, or I'll use the word queer. And so I think of that as kind of describing aspects of gender, of sexuality, and also kind of like a little bit of a political nature as well. So, yeah. Any other kinds of terms or words that people know that we haven't talked about? I think isn't it there's like Bi Visibility Week. I don't know if it ended or if we're in it, but it was, I think, last week. Okay. Well, if there are no other questions on words and terms, we can go to the next slide here. But here, so this is a note. How many of you have heard of this kind of word before, this kind of idea, intersectionality? Some people, like half and half. Yeah. I remember when I was doing my undergrad, it was kind of like the hot word. It was like the hot topic. Like, ooh, intersection. I was like, oh, what is that? I don't even know what that is. It's a big word. And it's a word that sounds very complicated, a topic that sounds very complicated. But it's actually just your different experiences all come together to form, or your different identities and different experiences come together to form you as an individual, right? And so different identities can interact, right? They can come together to form different experiences. And if we look through history, kind of an interesting historical example of that is, so when some of the kind of Western European scientists were classifying race in the early 19th century, when they classified kind of Caucasians or white people, they said, okay, well, we have men and we have women. And when they classified other races, they actually didn't give them a gender. And so they were all just, oh, it's this race, but men or women, whatever, we don't know, it doesn't matter. And so you had this kind of aspect of gender and race kind of coming together there, kind of forming an interesting experience, or forming an interesting kind of like, I don't know how to but it was interesting. But does that make sense to everyone? Any questions about this kind of concept? Okay. And maybe a quick question. So what are some examples of like intersecting identities you all can come up with, and what does that mean? Like, what comes into play? What are the implications for those? Can anyone give me like an example? I know once a year, I always see that like Instagram infographic pop up on my feed. It's like white women make 77 cents to the dollar. And then it has like all other kinds of different races and ethnicities who make different amounts for the dollar for women. Has anyone seen that?
I was actually gonna say, I've heard a lot about intersectionality actually, and one of the things that I hear a lot, for example, is LGBTQ people of color. They have their intersectionality of their race and their identity, which create experiences for them where they have both sides that they deal with as part of their intersectionality.
Yes, that's true. And I see Stephanie in the chat talked about the wage gap thing. I think you probably said this before. I should let you say it. Yeah. Okay, right. But the concept there is, right, all of these different intersecting identities can come together to form unique experiences. And sometimes those experiences can be compounding, right, in ways that are maybe positive or ways that are maybe negative, right? Okay. And so if there are no other questions here, I think we will start heading into our equal access rule. But I'm curious, what was something interesting, or what was something you all thought was interesting in that last section? Or something you learned that you didn't know? Or you can tell me you knew all of it, and I'll be very impressed.
All of it.
All of it?
Yeah. Well, the different identity, you know,
The
it's
different
just,
identities?
yeah, a lot of them that I don't know anything about. So it's, you know, learn a lot more than what I used to think of. So thank you for that.
And kind of the history of the unicorn graphic. Okay. Someone knows everything because they are on the internet. Yeah. Imperialism and persecution of LGBTQ plus identities. Yeah. Yeah. You know what's actually really interesting is you can track the history of colonialism and the persecution of kind of LGBTQ plus identities very directly in certain like penal codes and legal codes. And so when was, I think it was like last month or something, Singapore removed kind of an old British penal code relating to basically expression of gender and sexuality. But there are still several other Southeast Asian countries where you can look in their kind of legal code, their penal code, and they still have something that criminalizes maybe gender expressive behavior or sexuality that comes from the British Empire. So interesting fact. Okay, and I think with all of that, I'm going to pass it to my colleague, Joy. Joy, it's for you.
Great. Thanks, Nick. Yeah, so I'm just going to walk us through some information on the 2016 Equal Access Final Rule itself. This is going to be a little bit more in the regs, a little bit more dry, but I'll try to make it as engaging as possible for you all. So in September 2016, the Department of Housing and Urban Development had published this equal access in accordance with an individual's gender identity in community planning and development CPD programs rule, also known as the Equal Access Final Rule. So this rule updates HUD's 2012 Equal Access to Housing and HUD programs regardless of sexual orientation or gender identity rule, and the 2015 guidance on the treatment of transgender persons. So this final rule ensures that access to shelter, housing, and services is provided to an individual in accordance with the individual's gender identity. And this is defined as the gender with which the person identifies, regardless of the sex assigned to a person at birth or a person's perceived gender identity. So individuals are placed in housing in accordance with their gender identity, and there are no requirements for individuals to prove gender identity. This rule applies to all recipients and subrecipients of CPD programs and those who administer programs and services that provide temporary emergency shelter funded by CPD programs. So some examples include the Home Investment Partnerships Program, Continuum of Care Program, the Housing Trust Fund Program, Housing Opportunities for Persons with AIDS, Emergency Solutions Grants, and the Rural Housing Stability Assistance Program. Providers must update policies and procedures to reflect these requirements. And after this training, you'll all get a link in your email with some additional resources and information on this. Next slide. So what does implementing the equal access rule effectively mean? It means creating safe shelter and housing programs, serving people in alignment with their gender identity, and ensuring that all people have access to dignified and respectful services. So despite incremental improvements, we see that discriminatory issues are still taking place today. And since these issues are still occurring, ongoing training and education is necessary to ensure safety and equal access to services for all people. Next slide. So just to give you all an example, following the release of this updated 2016 Equal Access Rule, it continues to be applied inconsistently. And so in January 2016, the Center for American Progress released a study that was specifically focusing on discrimination experienced by transgender individuals who are seeking access to shelters. And this study consisted of 100 phone calls to homeless shelters in 4 states. That was Connecticut, Washington, Tennessee, and Virginia, by testers who identified themselves as transgender women who are seeking access to both women's shelters and general shelters. So this study found that only 30% of the shelters contacted by the testers were willing to house the transgender women in alignment with their gender identity. 13% offered to house the transgender women in isolation or with men. 21% of those shelters refused service altogether, and another 21% were unclear as to whether they could house transgender women in alignment with their gender identity. The study also reported that the testers were often referred to using the wrong gender or with other statements that discredited their gender identities. So for example, shelter employees made references to the testers' genitalia or to surgery as requirements for appropriate placement. And the shelter employees stated that other residents would be made uncomfortable or unsafe by the tester. So these findings are not limited to these 4 states only. According to the National Alliance to End Homelessness, nearly 2/3 of homeless shelters fail to enroll a person properly once they identified as transgender, and nearly 1/4 of homeless transgender residents report being assaulted by other residents or staff at a shelter. And if we go to the next slide, there's a little bit more information on the 2018 Bay Area LGBTQ needs assessment. So this was completed by 1,409 LGBTQIA plus community members throughout 9 Bay Area counties, including San Mateo. And this survey found that more than half of these respondents indicated that concerns about their safety limit where they can live, work, and get health care. 17% have been homeless at some point in their lives. 9% of all respondents had used housing services in the past 3 years. And 10% of respondents had an unmet need for housing services, with a greater average unmet need among those aged 18 to 24, gay and bisexual respondents, transgender, genderqueer, and non-binary respondents, those with incomes of $60,000 a year or less, and people of color. So this survey also found that close to half of respondents do not get what they need from housing services. And this was especially true for transgender, genderqueer, and non-binary respondents, and folks who had experienced an economic hardship. So not having a place to sleep for the night or not having enough food to eat, things like that. And the majority of survey respondents said that having access to LGBTQ specific housing services was important or critical, and relatively few of these folks reported accessing LGBTQ specific services. So the reason why we're sharing all of these statistics in the past couple of slides is to emphasize the importance of this rule. Discrimination against LGBTQIA plus folks in accessing safe shelter and housing programs continues to be an issue in the United States, as evidenced by these sources of information. So by following the Equal Access Rule, programs can help end this trend of discrimination and provide LGBTQIA plus folks access to safe and respectful shelter and housing programs in alignment with their gender identity. If we go to the next slide. This rule also amends HUD's definition of gender identity to clearly reflect the difference between actual and perceived gender identity so that service providers can ensure compliance with this rule. So the definition of gender identity is the gender with which a person identifies, regardless of the person's perceived gender identity or sex assigned at birth. So perceived gender identity means perceptions of someone based on their appearance, behavior, or as identified in documents. This rule also states that individuals must not be subjected to intrusive questioning or asked to provide anatomical information or evidence of gender identity. So this rule added the words identified in documents to make clear that the identification of gender or sex on an individual's ID documents may be different than a person's actual gender identity. So on this slide, we can see an example of actual gender identity versus perceived gender identity. Someone's actual gender identity as a man may be different than the gender or sex that is listed on their documents, but those documents should not be determining a person's gender identity. Someone's perceived gender identity is the gender with which a person is perceived to identify by other people, as opposed to what their identity actually is for themselves. So we want to actually always honor and act in alignment with what someone's actual gender identity is, rather than what someone may perceive that to be, or rather than what's written down on a piece of paper. But if we go to the next slide, we'll discuss addressing privacy concerns. So this rule states that all placements, including admission to facilities that require shared sleeping or bathing quarters, shall be made based on an individual's gender identity. So in place of a health and safety exception after admission to a program, a provider may take some non-discriminatory steps to address privacy concerns raised by residents and occupants, so long as they're not restricted to and do not isolate or segregate transgender or gender non-conforming occupants. So for example, privacy concerns can be addressed through policy adjustments, such as the use of schedules that provide equal access to bathing facilities, the use of privacy screens, and things like that. So on the next slide, another element of this rule is the definition of family. So in general, how family is defined in the equal access rule applies to both the ESG and CoC program rules. And the equal access rule itself defines family as a single person who may be an elderly person, displaced person, disabled person, near elderly person, or any other single person, or a group of persons residing together. And such a group can include, but isn't limited to, a family that it has or does not have children. So a child who is temporarily away from the home because of placement in foster care is considered a member of the family, an elderly family, a near elderly family, a disabled family, a displaced family, and the remaining member of a tenant family. So this one is, for example, if a group of people are living with their grandmother, who is the family member receiving assistance, and some members of this group leave, the remaining members of the household that remain in housing would be considered under this category. So family includes, but isn't limited to in any way, and is regardless of marital status, actual or perceived sexual orientation or gender identity, any group of persons that is presenting for assistance together. This can be with or without children, and is also irrespective of age, relationship, or whether or not a member of the household has a disability. So what all this means basically is that any group of people that are presenting together for assistance and identify themselves as a family, regardless of age or relationship or other factors, are considered to be a family. And so they must be served together as such. Further, a recipient or subrecipient that's receiving funds under the ESG or CoC programs cannot discriminate against a group of people that's presenting as a family based on the family composition. So for example, if it's made up of adults and children, or just a family of adults, the age of any family member, the disability status of any members of the family, marital status, actual perceived sexual orientation or gender identity. So does anyone have any questions about this language? We're going to go into examples in a second, but just wanted to pause and see if anyone has any questions or anything they're curious about. Okay, we can go on to the next slide. So here are some examples of some scenarios for families that the Equal Access Rule provides protections for. So a shelter can't separate out teenage boys from their families. A program wouldn't be able to separate out or deny assistance to adult men that present as part of a family. A shelter or housing program may limit assistance to households with children. However, it may not limit assistance to only women with children. If two adults present together as a family for housing, you must serve the two adults as a family and may not require proof of marriage or limit assistance to couples in a heterosexual relationship. Additionally, a housing program can't reduce the size of a family because one child is in foster care. So if a child is being placed in foster care away from the family, they'll still be considered part of the family under the Equal Access Rule. And next, to wrap up this section, we'd just like to elevate the county's commitment to equal access. So understanding LGBTQIA+ access issues is an important part of ending homelessness. And the County of San Mateo is committed to promoting housing first and client-centered approaches to working with people experiencing homelessness. Housing first is an evidence-based approach to ending homelessness in which programs are accessible to the most vulnerable people. An important part of a housing first system is access, which means ensuring that all people feel welcome, included, and safe in these programs. So as many of you know, there are opportunities to partner with organizations such as the Pride Center, the Street Medicine Team, and BHRS Outreach, who adapt or modify practices depending on individuals' needs and consider all aspects of an individual, including gender identity, their race and ethnicity, and things like that. So there's been great success collaborating with these local partners for healthcare needs and referring to ongoing healthcare providers that will best cater to client needs. And of course, having a client-centered system means that programs and systems are designed around client needs and respects client choice and self-determination. So therefore, it's important to be aware of the challenges that the LGBTQ+ population faces in accessing homeless services so that we can better serve folks. And ending homelessness means ending homelessness for all people, including those who have been historically denied equal access to these services. So with that, are there any more questions on this section before I pass it back to Nick?
I'm not sure if this is a question in the chat. Michael said intersectionality question mark. I don't know. Not quite sure what that what that means, but if you have a question, feel free to expand on it or come off of mute and we can chat about it. Okay, here we go. But I guess we can move on to this next section here. And so this is where we're gonna be talking about some different best practices, and I'm gonna try and break this up through different types of roles or different types of parts of the system. And so first here, let's start with outreach, engagement, and assessment. And so just out of curiosity, how many like outreach workers do I have here, or how many people here do like assessments, like you do VI SPDAT or something like that? Some outreach people who do intake and stuff. A few nods here and there. Okay. And so equal access kind of during these initial kind of first contact moments. It means accepting the name and individual given by, accepting the name and gender given, sorry, by the individual. Using the kind of pronoun that they indicated, right? And if there is some kind of government documentation or something that's required, maybe for one of your programs, right? Still using the name and kind of gender identity that they tell you, right? As indicated by the individual, not the ID. You can think of it as like, you know, how many people go out in the world using their legal name? You know, not a lot, right? Even if you think of people who the gender they identify with matches kind of what's on their government documentation. But other things during kind of the outreach, engagement, assessment phases, you know, especially because these are kind of like almost your first touches, right? And so that first interaction can have such a powerful and such an important impact, you know, on what your relationship is going to be like with that person, how accurate the information they're going to give you is going to be, how willing they are to come back or to engage in further kinds of services. It's going to impact like everything down the line, right? And so to give you some examples, I used to be like a community health outreach worker, right? And so we would go into like bars or clubs or whatever, just like on the street. We do a lot of things relating to kind of like sexual health and some kind of vaccination stuff. You know, but that first interaction is so important, right? And being able to kind of read read how the interaction is going and make that person comfortable. And so, you know, we were asking very kind of like invasive questions, right? It's like sexual health questions. It's like literally how many people have you had sex with? Have you had this STI in the past 3 months? Like very detailed, very like intimate questions, right? Probably some of what you might be asking if you're an outreach worker, you're doing assessments, right? And you know how awkward like some of those questions can be to ask, right? They're not always the easiest to ask people. You know, but when you create a supportive environment, when you create kind of like an environment where someone feels comfortable, they're going to give you more accurate answers. And so sometimes when I would go into like a bar or something like that, or we're meeting people kind of outside of the street, or there's this event going on, it meant, okay, well, we're going to walk around the corner and we're going to do our little like assessment over here, or we're going to take this and we're going to go over here. Or if I'm, you know, maybe starting to engage with this person, starting to talk with this person, I'm looking at their body language and they're looking around, they're kind of like, maybe they seem uncomfortable. That can be your cue. Okay, well, let's take this around the corner, or let's do this over here, or away from this kind of certain spot. Different things like that are going to be very important, right? And especially when you're thinking about trying to make clients feel comfortable who maybe they got thrown out of their house because they identify as transgender, right? That's not going to be something they're going to be readily willing to like chat about with a random stranger, right? It's going to be a traumatic experience for them. And so if depending on like what kinds of outreach we're doing or what kinds of events, right? That's where I would wear maybe like a trans flag pin or something like that to kind of very easily and visually indicate like, oh, okay, like I'm trying to create a safe environment for you. This is going to be a safe space where we can talk about this. Preempting in the conversation, right? Like my name is blah, blah, blah. I identify as blah, blah, blah. These are the pronouns that I use. Something like that can also very easily and very quickly signal to someone, right? What your kind of familiarity is with those kinds of topics and how safe they might feel with you. I'm curious too, for other people who are like outreach workers or doing assessments, you know, what types of things do you come across or have you come across kind of in your work, right? Are there certain kinds of tips you would give others and like, this is what I do to try and make, you know, clients feel comfortable? Or maybe it's, I had this kind of situation and I didn't know what to do. I know we have some outreach workers.
Well, I used to be an outreach worker, but now I work for a mental health association.
Mm-hmm.
And so I've had a few different jobs in this organization. One of them was the AIDS housing program.
Mm-hmm.
Help with rent and PG&E and stuff like that. And when you're doing the initial paperwork, there's some questions in there, you know, like the ones you had mentioned.
Yeah.
And so I try and just, you know, make them feel as comfortable as possible and explain there's some embarrassing questions coming up. And there is a box that says, you know, no response or something. So a lot of times I'd say, you know, you don't have to answer these if you don't want to. It wasn't a condition of getting in the program. So when I said, you know, you don't have to answer it, a lot of times they would answer it anyway, even if they seemed uncomfortable. And it can be tough because, you know, I'm a single white male, 62 years old, and, you know, people think a certain way. And so, you know, you really got to try and make them feel comfortable that it's okay, you know, and sometimes it can be difficult.
Mm-hmm. Yeah, and I think especially too, that's where some of those visual cues can be helpful, right? So things like, you know, I'm wear a trans flag pin or something like that. You know, like if I'm going into a community where I'm like very clearly not part of, well, this is my community, this is like, you know, where I'm from, right? Being able to build that rapport, sometimes through visual cues or sometimes through other things, or maybe just like upfront acknowledging it, right? Like, I know I'm not like blah, 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 or I'm not blah, 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 you know, but I'm still here to help you because this is my job, you know, things like that.
I find that using humor to get people laugh,
Yes.
making them feel comfortable goes a long ways. So, and then there's a bunch of different stuff. I'm a people person, so, you know, once you get it across that, you know, don't judge me the way I look, that open the doors with some clients.
Yeah, I think humor is always a good one. Like humor was my go-to, kind of like joking, like, oh, haha, you know, like we're talking about like sexual health. Okay, how many partners have you had? Blah, 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 you know, and kind of making like jokes about it, like me, like, oh, haha, I'm a hoe too. Like, it's okay, you know, things like that. Make people feel very comfortable very quickly. But here we go. And so let's go to this next phase here. And so enrollment. So access, equal access and enrollment, it can mean something like providing a private area. Say a client comes into your office, you're some kind of provider of services or housing or something. It could be, okay, we're going to go to a conference room and we're going to talk about some of the programs and services here. You know, at the old agency that I used to work at, they had a clinic. It was for like transgender patients. And so, you know, if there was someone who was kind of like coming in, they seemed like, I don't know if I should be here, or like they seemed like kind of uncomfortable in the space, like a little apprehensive, then that was the cue, like, okay, well, let's go to the conference room. Let's talk about, okay, we have this service, we have this program. Do any of these apply to you? Like, would you want to be a part of any of these? And so a private area can be a good place to make people feel comfortable and that their kind of information and what's being talked about is confidential. Another kind of way equal access comes in enrollment. You know, part of it is basically asking, like, think about what you really need to collect to enroll someone in the program and think about what you don't need to collect. Because there are a lot of programs and a lot of providers, right, that collect information that you don't really need to have, right? Like a lot of times you don't actually need like a photocopy of someone's like government issue ID or something like that. You know, there are all different kinds of documentation that people may collect or providers may collect that you usually don't really need to, right? And it's a little bit of a barrier. Other things that included in that, right, is sex assigned at birth, right? Like, does your program really need to have it? You know, probably not. You know, but if you do have a project or some kind of program or something that's based on gender, say you're like, we have like a women's shelter or something like that, right? Accepting the client whose gender expression does not fit, whatever you think of as being the stereotypical gender expression. And say if a client is non-binary, this means discussing these are the options that we have, this is what's available, what would you be most comfortable in? And so equal access is not asking like all of you as providers, like, okay, well, now you need to build a whole new shelter that's for non-binary people. Like, that's not what equal access is asking you. It's saying, you're going to make the reasonable accommodations for someone, right? Like, obviously, you can't just go out and build a new shelter. No one has that. No one has that kind of money. If we did, we wouldn't even be sitting here talking about, homelessness, right? But it's discussing with the client, well, this is what we have, like, what can we make work? How can we make it work? During unit and bed assignment, this equal access means quickly resolving conflicts, right? And so it can mean, thinking about, okay, where is this placement going to be? Who is this person going to be placed with? What, when someone reports some kind of harassment or something, kind of addressing it very early on and initially, right? And it also means modeling kind of this respectfulness and appropriate behavior, right? And so I think you see a lot of modeling now, I think in just people's email signatures, right? Like you have people who introduce themselves with their pronouns, you have pronouns and email signatures. At the beginning of this kind of training, right? That's something we modeled. We said, okay, well, this is my pronoun. And then you kind of go on and continue it, right? That's like modeling. Again, if there are like issues that arise, when you have a client that's been placed, maybe it means having a conversation in a private space, right? Maybe it means not having the discussion about what happened in the shelter in the hallway. Maybe it means going into a conference room or something like that, or making sure the door of the office is closed when you have that conversation, right? Again, it kind of goes back to, how can you make someone feel safe in the space that you have? So equal access and ongoing service means respecting the client's right to access all the services for which they are eligible, right? So that align with their gender identity. It means correcting if any clients have kind of misperceptions that someone's gender expression creates a safety risk, right? And so if you have like, a sex segregated facility or something like that, right? And that like, oh, I'm going to be attacked if this person is in the shelter. I'm going to be attacked if this person is in the bathroom or something like that, right? I think the bathroom is always like a very popular topic, which is always so interesting to me because if you go to like, any gay club, none of the bathrooms are gendered. You just go into whichever bathroom and that's it. Everyone's just trying to pee, it's like, it's not a big thing. And then you realize how kind of ridiculous this whole bathroom kind of scenario is, right? Because it's like, if you're afraid of being attacked in a bathroom, like there are much better places where someone's going to come for you than a bathroom. And so again, during ongoing services, equal access means also ensuring that clients understand that verbal or physical bullying are not tolerated. Right. So if you have to have that conversation with one of your clients because they're harassing someone else, that's what equal access means, like having some of those tough conversations, just as you would if there were other kinds of conflicts between clients that you're working with. Right. Okay. And so changing the culture. So how do we kind of make some of this longer lasting? How do we continue it? How do we do this in our, organization, across our organization, right? And so there are a lot of ways, right? It's kind of what are the written policies and procedures that your organization has for your staff? It's things like this, staff training, right? Hopefully you all learned some new and interesting things here. Hopefully you learned some new tips, some best practices, some different things that you can take away with you, right? If you did, you are a part of changing the culture. Congratulations. Part of this is also kind of not only what a frontline staff person might get, trained on, but also for supervisors and for management of staff, right? Like say a client is complaining about a staff member, right? That's something that has to be dealt with by a supervisor or management, right? Communications of expectations to clients, right? And so that is something like, say, for example, there is a reported instance of harassment. So, communication could be, well, we heard, let's see, like this was we like observed this happening, right? And like, this is what's going to happen if we see this kind of altercation again, or just kind of really going back into what your kind of procedures are and what your policies are in cases of harassment and making that very clear, right? Day-to-day interactions, some of what we've talked about. And yeah, the last one is kind of what we just talked about as well. But are there any questions on any of these? I knew we threw a lot of things at you here, but any questions? Anything you want to add?
I have a question.
I think I hear someone, but it's very, very light. Try again.
I think that might be Roberto. I saw was unmuted for a second.
I think
he's right here. We're trying to help him out. Hold on.
Hello, can you hear me?
We can hear you. I can hear you. It's very soft.
Yeah, dude.
So I don't know where your mic is, but maybe try speaking into the mic a little bit.
Can you want to use my room?
Okay, I'll do that.
Right here.
Oh, there we go. A little switcheroo.
Hello, can you hear me?
Yes.
Okay, so I just had a quick question. When it comes to comfort levels, like with client comfort levels who are from LGBTQ communities, or even like other communities, one thing I've heard of, like said before, is about talked about is microaggressions. I'm wondering if you, Nick, or anyone else knows what they are, if they can explain it a little bit.
Yes. And so I think microaggression, how would you define a microaggression? It's kind of like a little, it can be kind of like a comment or maybe like a phrase or kind of an action or something that someone does that's kind of like a little jab, if you will, kind of like maybe it's like a backhanded compliment, or maybe it's kind of like a side comment or something like that, that's kind of like poking at someone's identity. It could be like what's a common one? You seem very straight for someone who's gay, something like that, right? Or you have very nice hair for like a Black person, something like that. So something that could be like a backhanded compliment, but is in a way like also like not really a compliment and like kind of an insult. Does that make sense? But it's also something, so microaggressions are typically something that are differentiated from what would be like a case of sexual harassment or something like that. So like once you get to the point of like harassment or it's kind of like a different like legal definition, right? And so a microaggression is something that might not necessarily fall to that level of, oh, this person is sexually harassing me. But it could be like these comments are not the kind of comments someone should be making. Does that make sense?
Yeah, and so like, for example, if I see two clients, interacting, and maybe I'm like, should I step in to try to mediate that conversation if I can tell it's either a microaggression or like something direct going on, and like what is the best way to mediate something like that?
I guess so. And I'd be curious to hear what other people kind of think also, but I think typically what I would tend to do is, I would, leave it to the individual, right? I don't necessarily kind of want to, it's like, say there's two people who are talking, right? Or two of your clients who are talking and they're having a conversation. You're like, oh, okay, it sounds like this person is like saying all these microaggressions or something like that. For me, I might not know the context of their conversation. I not know the context of their relationship. And so I would typically say afterward, I'd maybe like check in with someone, right? And I think this is where it varies too, and where it's like tricky, because it's also based on like, it has to be, your judgment in a way too, like what level is this conversation? Is this like they're yelling at each other? Is it like maybe they're having a good time and joking, like maybe they're not? And that's where it kind of gets more nuanced and tricky, right? But I think usually how I would handle something like that doesn't seem like an immediate threat or an immediate danger is I would probably kind of check in with the person after to see, what they thought about it. Because you also want to give the person their agency, right? So it's like, well, maybe I'm perceiving this as something that would be like a microaggression, or I'm perceiving this thing as insulting. But between them or to that person, they don't care, or they think it's fine, or it's like, that's just how they talk to each other. Does that kind of make sense?
Thank you.
Hi, this is Marina. And so what I will do probably if I have a relationship with the client, I will ask aside in private, how is that person feeling? And then I'll address that if needed.
Yeah. Any kinds of other questions? We're actually going to move on to some of our scenarios in a sec, but did you have a question, Bob, or something, or a comment?
Well, I worked in the shelter system for a long time. Been into this issue a few times. I used to work at Maple Street shelter, and then recently I worked at Spring Street. And it's hard you can't really pull up people on microaggressions, because sometimes it's even hard to see straight aggression, much less a micro. But I think you're right. The client has to feel something or be offended. And if they come to you or you check in with them, like Marina said, then you address that. You bring the client in your office, the other client, and say, explain the rules, what's going on. And if this happens again, you're going to be exiting, because that's anything sexual in the shelters. You got to be careful. And so people have been exited for around that area, being aggressive towards transgender or anyone else. So there you go.
And see what Bob said here. I want to point to the slides again, right? Communication of expectations to clients. Tick that bullet point right there. But any other kinds of final questions here? I think we're gonna stop sharing here, because next we're going to go into our little, actually we have some instructions here. We're gonna go into our little role play and discussion. And so how this is going to work is we are going to ask folks to kind of break out into based on role, right? So based on, are you like an outreach worker? Do you do assessments? I forget what our categories are, but basically whichever category best kind of applies to your role and what your job duties are. And so we're going to open up those breakout rooms in a sec, and then ask you to kind of self-sort into them. Joy and I will be popping in and out between the different rooms, and we are also going to copy and paste some scenarios into the chat. And so we're going to ask you to pick some of the scenarios that are most relevant to kind of what you do in your position, right? And see if you can work through those. And I've been told that these are pretty, some of them can be pretty hard and pretty real world. And so we've done a lot of honing of these scenarios. And actually, I think most of them are just like real scenarios that have popped up in chats. So you may see these as well or have seen these. And so, yes, the categories we have street outreach. If you're a shelter, if you're a housing provider, operator, or kind of general services. And so I'm going to stop sharing here. Okay, and do I open the breakout rooms?
Open the breakout rooms, Nick, but we got to put the scenarios in the chat first, so everybody's got them.
I will do that. That's right, because if I don't put them in now, when you go to the breakout rooms, you won't see them, which is something I've done before. Here we go. Give me one sec.
Yeah, while Nick is doing that, I'm going to emphasize one more time that Joy and Nick are going to be bumping between breakout rooms. So it'd be helpful for you all to identify somebody in the group to sort of lead you a bit, or you can all work together to lead the group, but you won't have a specific facilitator in your breakout rooms.
Here we go. Okay, so you're going to have to scroll a little bit in the chat, but I think this might be the best way. But here we go. If I can post it. I think I can only post a few at a time. Let me try. Okay. Give me one. I have to post them 2 at a time. Give me one sec.
Oh, geez. I'm going to pause our recording as well.
Everyone. Here we go. How did those breakout rooms go? We have about 10 minutes left here, so let's hear some of the scenarios you worked through. Let's hear maybe some of the challenges or questions you all had. Maybe interesting ways you found of dealing with situations. How'd it go?
In our group, one of the questions that I brought up personally is really interesting for me was the number 11, religious freedom as justification. And we kind of determined that, you know, if they're not adhering, because I knew I knew a little bit of grant writing from my mom, who did a lot of grant writing in nonprofits. So I knew HUD was a government-backed grant, and then also someone else in the group, unfortunately I don't remember who, but they also mentioned that ESG was a government backed grant. And so if this, you know, like personal reasons aside, if someone were to sue them, they would be like in deep water, because ESG and HUD are backed by the law. And you know, we talked about it in the lecture, how there are laws that protect LGBTQ people. So if they're not, you know, conforming to someone's gender identity, not accommodating someone based on their gender identity, then they could be viable to legal action.
Yeah, so you are correct. This was actually like a bonus one I put on. I literally just pulled this from a news headline. And so this was like an actual real world scenario. This was in Alaska. And so the shelter was getting, like, as you said, like these government grants that fall under equal access. They were doing this. They legally shouldn't be doing this. And so like ultimately what could happen to them, I don't know. I didn't follow the story like to the end. I think they got like, you know, a slap on the wrist by HUD or some kind of monitoring, you know, but when HUD goes back and when they're like, hey, are you actually like doing what you say you're going to do? It's called monitoring. If they find out you're not doing what you're supposed to do, they'll take away your money. And that's like a pretty big incentive, is taking people need you need the money, right? If you don't follow the laws, then they're going to take away your money. So Yeah, but what else? What other kind of scenarios did people work through, or how did you kind of work through some of these?
Aura, we talked about number 2, I guess placing someone in shelter. So that situation I've run into a few times, and we had a lot of people that have worked in shelters, done a bunch of various different jobs, and kind of hopefully there's something written down on what you're supposed to do. At the end of the day, you just need to do the best you can, make the best decision, include your supervisor. If you are the supervisor, you ought to know what should happen. Sometimes you have to make moves when there's fights or disagreements in different dorms. Sometimes it's not always fair. And most shelters I've worked in, there's a zero tolerance for that kind of situation where you're talking about someone's sexuality, that'll get you bounced out of shelter really quick.
Yeah, I know I heard one of the other groups they were talking was about number 4, right? So it's like a youth facility and one of the youth is getting like harassed in the hallway. And I think what can really help everyone just like work through these scenarios, right, is if you think about, okay, well, if this was a different type of harassment, how would this situation be handled? Right? Okay, there's 2 youth in this hallway, you know, there are 2 people who are physically blocking one person from going down the hallway. If it was like any other kind of instance of harassment or anything else, like what would your policy be on someone like not letting someone go somewhere, right? And so kind of going back to that kind of core thing, right?
No bullying whatsoever. If people get warned and say, we see this again, and if they continue the behavior, they get exited and get hopefully a referral to another shelter.
And so that's the clear communications, right? The clear communication of policy, right? Going back to that other bullet point. What else? Did anyone have like a scenario or something they weren't able to work through, or like wasn't sure maybe exactly what to do?
We also talked about number 11, which is the one regarding like a religious
Is this Eva, you're turning into a robot a little bit. Can you hear me?
And there's something that I brought up, which is even like if they do get that slap on the wrist.
I'm gonna try turning your video off, and maybe it'll help with your audio.
Oh,
yes,
that's no good.
Oh, try talking again.
Yes.
Yeah, you were jumping. You were like a robot.
Do I?
Wait, keep talking. Maybe.
Hello?
Almost. Try typing it in the chat. Your audio's.
How do I sound now?
Keep going. Try it. Try one more time.
Yeah. Okay. I'll let somebody else talk.
Okay. Yeah. Try putting it in the.
I'll just type it out. So we were talking about number 11.
I know technology issues. We all have them. Glad no one has had to tell me I'm on mute today. That's an accomplishment. Anything else that anyone kind of wants to share or talk about? I think we're almost kind of at the end here. And I believe we have a survey for all of you as well, which we're going to send around. But any last final kind of thoughts or comments or questions or anything before we get ready to close out here? Okay, I know Eva is busily chapping. Oh my God, I can't talk anymore. Typing into the chat. Okay. But I think with that, Maddie, I think you have the survey. Oh, here we go. Okay, Maddie beat me to it. But we just put in the chat here a kind of survey. And so if you could please take that survey, well, let us know, what you found interesting, what we can improve, what was good, what was bad, all of that, what you found useful. And so we would appreciate if you take that survey. And let's see, Eva, let's see. Yeah, that's the question, Eva, right? It's a very good point. I don't know, maybe I should follow up with that Alaska story. I wonder what kind of like ended up happening. But typically, and in theory, what also should happen is that as kind of like a CoC or a continuum of care, right? There's like annual monitoring that happens to kind of look for these types of things. And so most communities should have, or, in theory should have these like annual process kind of review kinds of things, and where it'll be based on, what is the input from your clients? How are you kind of like treating your clients? Are you following these things, you're supposed to be following? And so in theory, it should not happen as much over time or should get better over time. But that is a good point, right? But I think with that, it is about 3 p.m. I believe this is our cutoff time here. And so thank you all for joining us. Thank you for kind of sharing your thoughts, your questions, some of your expertise from work, your different scenarios, working through it and stuff. If you have any questions, feel free to email us. We are going to be emailing out just kind of like a little resource folder and the slides and stuff like that, so everyone has them. But if you have questions, feel free to email us. And with that, I think, do I pass it back to you, Lottie?
Yeah, no, that's okay. I think since we are at time, I'll just echo your thank you to the group for your time and spending time participating today.
Fabulous. Thank you, everyone.
Thanks, everybody.
Thank you.